Stuff is, man, who knows where anything is at that point? Who cares? Do we do abdominal position as well? So you're just doing rib raking in between. Feels quite. Oh, okay, you're doing great.
Yeah.
All you do is go in between on the intercostals. About 35 weeks, they might start complaining about unilateral rib pain. That's because what happens, and I talked about this. Oh, we'll find out. Okay.
And then you're just pushing down on there to get some movement for while you're
Yeah.
scraping up.
You got it. I do weird things, and they make sense to me, so I just keep doing them. Weird's good.
I like it.
Ticklish on this side?
No.
Neat.
I don't know. Who cares?
We learned something neat about you
This is
today,
how
Ness.
you
Now you
know.
know. Now you know. A little rib breaking, calling it a day. Okay, next thing we're going to talk about is with pubic symphysis dysfunction or round ligament pain or just like fire. Okay. So you're going to come. Let's pretend she has a belly. Pretend she has a belly. I can't make one with you. What you're going to do is scoop underneath the belly very gently and lift up. Does that make sense? I'm lifting up and holding, trying to pull this tissue away from the pelvis. I don't want you to think you're coming in and you're like, I've watched students do it and they like heft. We're not hefting. That's gross. That's kind of mean. Let's not do that. It's a gentle lift and just hold it.
Where are your hands like landmark-wise?
Scooping.
Right under the belly. And I can't, like, usually
no
it's kind
fair.
of like hip and groin. I'm right in that like
Yeah, that's
zone. And my hands do just do this.
Okay.
Usually like you're kind of wrapping around.
Yeah, no, that's fair.
Does that make sense?
Yeah, just picture your belly.
Up, picture a belly.
Yeah.
If you can go right in the middle too. I just let them know I'm gonna come right in the middle. So if you're uncomfortable, let me know. If I was a male, I wouldn't room this way, and you would go on the opposite side. Same thing, very gentle. Everything's very gentle. This is a very vulnerable space for people, even if they're not pregnant. It's your tummy.
When you do a treatment like this, do you
Yep.
talk throughout when you're doing
A person, we're not trying to get under ribs at all. But what we're gonna do, I'm just gonna palpate for your xiphoid process, and you're totally okay. Like you're totally covered. Okay, good.
I trust you.
Okay, good. I'm glad you do. Thank you. Okay, I found the tip of your xiphoid process. Remember, it's a little. Does that feel right? Okay, it's a pointy. Yours is inwards, and it bouncy, right? I'm gonna go a couple inches down. So I'm gonna move straight down from that xiphoid process. Nas, can you take a deep breath in? And when she exhales, I'm gonna push posteriorly, and then I'm gonna start moving laterally away from myself. And I'm just gonna follow the line of the ribs. You just breathe normally now, girl. You don't gotta do anything.
I'm just trying not to laugh.
Yeah, you do. Are you ticklish right now?
Oh, it just feels weird.
I know it doesn't.
I'm so
It's,
sorry.
no, don't be sorry. It
I'm
doesn't
kicking
feel
you
great.
off.
And you're gonna move as laterally as you can, and generally with a pregnant person, you're gonna get to about there, and you can't go any more. And then what you're gonna do is a great job, Max. And you're gonna go over to the other side, walkie.
Arms are squeezing.
No, nothing's
Are you
really
Hold
squeezing.
for how many minutes?
You're just holding there. You're not
How many
going up or
seconds?
anything.
No. So I'm gonna reset myself. I squeezed in and lifted up as we all digest our food. And Nas, how much of that do you feel?
Very little.
Very little. What I don't want to see is this, and this is all students are like, I don't feel anything though. And you're like, does your client feel that? Because they don't feel good. I'm so sorry, Nas.
Oh, that was fine.
Okay. No, it's very gentle, in and up. And then what you're trying to feel is you'll feel a slight shifting in the pubis or in the hips where something will just let go. So this is where you're going to close your eyes and you're really going to just trust what the information is that your hands are giving you, okay? You can also do this one side at a time. So I'll sometimes just do it one side at a time, and what I'll do is bring the tissues up from the quads up. We'll hold it, and then we'll go to the other side. Okay? Goal, massage, right? So whatever you like to do, you can still treat SEM, you can still strip the scalenes, you can still do all your great work. You just don't get to sit down and do it anymore. So sorry about that. But this is quite comfortable, and I really like it as a massage therapist because I like the angle at which I can work. Does that make any sense? So still treating SCM, you can still get into posterior cervical. Although I know that we treated it already, why not hit it up again, right? And go live your best life. Done, done, done. SCM. You don't need to teach me. I don't need to teach you a cervical massage at this juncture. One day maybe I will. Up, and we're done. So all females can go. Nas, you stay.
Perfect.
You start partnering up